Go ahead. Okay. Hello, I'm Mary Tally Bowden. Believe it or not, this is my first press conference. I ask you to be nice. I have four very protective boys that know how to access my Twitter account, and they have no filter, so please be nice. It's hard for me to believe that I'm sitting here. About a week and a half ago, my frustrations came to a head and sent an email to my patients. And I'm a small practice. I'm a solo physician. I've been here for 2 years. I started off with the intention of just doing ear, nose, and throat and sleep medicine, and somehow stumbled into COVID. I was just responding to what my patients were asking me to do. They wanted to get tested because they didn't have access to testing, and I found a way to do that. And I never rationed testing. I provided access when access was hard to come by. So over the span of the pandemic, I've been open 7 days a week. I've tested over 80,000 people, and I have treated about 2,000 people. I'm a good doctor. I fight for my patients. I treat my patients the way I would want myself treated. I've been on the other end of the patient-physician relationship. As a mom of 4 boys, I basically spent 5 years as a patient, 5 straight years of pregnancy. So I know what it's like. And when I opened this practice, my intention was to treat people the way I would want to be treated as a patient, and to treat people the way I would treat a loved one. And that is how I have treated my patients during COVID. So it was quite a surprise to me last Friday when I got a text message from the Houston Chronicle telling me that my hospital privileges had been suspended. It's not the way things like this are normally handled. I had very loose ties to Methodist. I only have privileges there in case I have a patient that is so sick that they need to be hospitalized. And I'm proud to say that because of my early and aggressive treatment for patients with COVID, I have not needed to admit anybody to Methodist. So I'm not quite sure why I became their target, although I think based on their history of being the first hospital in the country to mandate vaccines for their employees, that they are using me as an example based on what they have read, which I have not sent to them, but I've sent to my patients, and I have vocalized on Twitter. But since when is that a reason to take away somebody's hospital privileges, try to take away their license? I'm not saying Methodist is doing that, but there are groups that are targeting doctors like myself that are just simply trying to speak about what they are seeing. And I don't have research papers to back what I'm doing personally. I have tons of data. I have tons of clinical experience. And when I speak to my patients about what is going on, it is based on my clinical experience. And that should be good enough. And I'm not sure in this day and age, apparently it's not. It's astounding to me as a physician that I'm not entitled to my medical opinion. I think this is hopefully, this is not how I wanted to be. I would like to go back to my clinic and stop. I do not want to be in the media, and I do not appreciate the way Methodists handled this. I'm simply trying to help my patients.
So, doctor, why hold a press conference?
Because my name is being vilified. I have people leaving fake reviews on my website, all over the media. I have people calling me a sister of the devil and misconstruing my intentions. So I want to set the record straight. I don't feel like I'm getting fair coverage of my side of the story.
Dr. Bowden, I guess the issue from Methodist standpoint, some of the people online, is that you're using ivermectin, which has not been proven effective by the FDA against treatment of COVID-19. I guess kind of explain to us why you have used it to treat patients.
Well, when I did a survey of all the patients that I've treated with monoclonal antibodies, and I asked them what medications they're taking, 30% of them said they are taking ivermectin, which is a large number of people. I don't know how ivermectin has become a dirty word. It's a safe medication, and I would never give anything to anybody that I thought was going to hurt them. And I did deep research into whether or not I thought it was going to hurt them. So I stand by ivermectin. I have plenty of people who have taken it, and no one has had a serious reaction from ivermectin. Again, it's clinical experience.
So the 30% of patients that you surveyed, are they the ones that you've treated with ivermectin or others?
No, the 30% of the patients that I've treated with monoclonal antibodies all told me they were taking ivermectin at the same time.
Doctor, what's next for you? Where do you go from there?
Continue doing what I'm doing.
Are you considering any kind of legal action against Methodist at this point?
I'm not going to comment on that.
Have you had any conversations with anybody at Methodist directly, either?
No.
So all of this has happened through social media or what you've
Well,
read?
they have sent me official letters, but there have been no conversations.
Do you plan to have any?
I'll have to ask my lawyer. I don't know. I
What's the
don't know.
message does Methodist you want to deliver today?
Well, Methodist has touted itself as the example that the rest of the country should follow in terms of vaccines. But why are they not sharing with us more data? Why do we not know how many breakthrough cases they have? Why do we not know how many patients who have been vaccinated have had side effects? Why do we not know a firm number of the patients in the hospital who are vaccinated? So if they want to be the leaders in COVID, then they need to share all the data. They also need to perhaps not vilify doctors who are challenging what the vaccine movement.
I have a question. So the people that came, you said you treated people for COVID, am I right? Okay, so that treatment ever included the vaccine, or it was just?
I tried to get the vaccine to my clinic when
Okay.
it first came out, and I could not get it because I was not a hospital. I basically felt like I was too small to be worthy, and so I just gave up. So no, I don't distribute the vaccine.
So I do take that. You wanted to give the vaccine out. You were
Yes, I was on board with it. I tried to get it, and
So
they were
you
just
have-
giving it out to the hospitals, and
You
I
have
gave
nothing
up.
against the vaccine.
Nothing against the vaccine. I don't think there's a one-size-fits-all for the vaccine, but I have nothing against it. There's certainly an important tool against this pandemic.
Did you take it as part of Methodist's requirements?
That is not something, I don't even ask my patients that, and I am offended that other people would ask me that. It's a HIPAA violation. It's a personal health information. And it's
Dr. Bowden, on your website, you said you were on staff at Methodist as well as the Memorial Hermann Hospital.
I have privileges at 2 surgery centers through Memorial Hermann.
Memorial Hermann.
Yeah.
They said you did not have any privileges at acute care
At the hospital, no, the surgery centers.
service.
So you said that you treat 30% of your patients, right? 30%, is that right? 30%
What?
of your patients were treated of this COVID? Is that what you said?
Yeah.
30%?
Wait, what?
30%
Of what?
of your patients were treated of COVID, right? COVID? Is that what you said? 30%?
30% of the patients were treated for COVID. That's what he's trying to
Is
say.
that what you said, right?
I don't understand. No, I don't.
So you said 30% of the patients surveyed said that they use.
No, 30% of the patients that I treated with monoclonal antibodies were taking ivermectin at the same time. Not from me, just happened to be from other physicians.
Oh, but they were not from you.
No, well, I mean, maybe some of them were, but I don't know. I mean, a lot of these people just come to me because I allow easy access to monoclonal antibodies.
Doctor, you updated us on the Fort Worth case and which sort of seems to have sparked all three of them.
So I have a patient in Fort Worth at the Texas Hughley Hospital, 48-year-old man, family, father of 6, sheriff's deputy. He's been in the hospital for over a month. He's been on a ventilator for over a month. His wife reached out to me to try to have me prescribe ivermectin because she wanted to try everything she could to save her dying husband. I agreed, and then she had to have a lawyer get involved because the hospital refused. So I testified on behalf of my patient, and we won the case, and the hospital was told to grant me temporary privileges and do it quickly, and unfortunately they decided to stall, and they waited until that Friday afternoon when I sent the email to my patients to tell me that they were denying my request for temporary privileges. And this is with I have a clean record. I've never been sued, no complaints. So there was no clear reason why they would deny my privileges. The lawyers went back to the judge and they said, okay, well, we'll do the privileges, but with some modifications. We'll only grant you privileges to only administer ivermectin, and you have to come and do it yourself or have a nurse do it. No one on our staff will actually give the ivermectin. So I agreed, we did that, apparently, and then we lined up a nurse to come give the ivermectin. The nurse came to the hospital and tried to get in, and apparently the hospital had issued an appeal, but this was not given to the patient's lawyer yet. So she thought she had her every right to be there, and the hospital called the police on the nurse and had her escorted out of the hospital because she thought she was following a court order. We could not clarify what was going on the next day because it was Veterans Day. The following day, we found out there was a stay on the order. Today, that appeal is being processed, so we're hoping to have an answer tonight or tomorrow morning. The patient is stable, but he's still on a ventilator.
And you said that because of the Texas Children's the hospital, because they were the first hospital to mandate vaccines, they were trying to make an example out of you. Can you please elaborate on what you meant by that?
I am a solo physician. I have a few thousand patients. I am a flea on the elephant of Methodists. I am not a threat to them. I don't quite understand why they need to single me out with this. They could have suspended my privileges very quietly. But instead, they took it straight to the media. I wouldn't be here right now if it weren't for them taking it to the Houston Chronicle. So I think they're trying to make an example out of me. I think they're trying to show people, okay, if you speak your mind, if you dare challenge the vaccine agenda, then this is what happens to you. You stand in front of your clinic with 20 reporters and, they beat you down.
Do you have an idea how many patients you've been treated with?
A few hundred, probably.
And they're all okay?
They're all alive and well. I had one patient tell me she suffered temporary blurry vision, but she wanted to keep taking it nonetheless. But that's all I've had.
Doc, we talked this morning, you talked about what you want Methodist to now show the public.
Right.
Demonstrate. What do you want them to show?
I want them to show all their data. Let's have some data transparency. If they are so confident in their position, let's see it all. Let's see complications, complaints. Let's see breakthrough cases. Let's see all their data.
Dr. Bowden, have you been contacted by the Texas Medical Board in relation to anything that's gone on in Houston specifically?
Well, no, not Houston, but there is an online group targeting me, encouraging the public to report me to the medical board.
Have you received any correspondence directly from the Texas Medical Board?
Yes, regarding the patient in Fort Worth.
What do you say to the FDA? Because obviously you know that only medicines that are approved by the FDA can be given to patients, but maybe there's a problem. I mean,
This is an awful. Ivermectin is before I started prescribing ivermectin, I went to the original study where FDA approved it for human use, and I made sure to research the data and the safety. That was the first thing I did. So it is definitely an FDA-approved drug. There's a difference. It's an off-label use of an FDA-approved drug, which is done very commonly. If you look at the data, the safety data, if you do a literature review of ivermectin and try to find patients that have died from ivermectin overdose, I challenge you to do that.
Ma'am, how do you feel about this whole thing? How do you feel about this whole incident, this whole thing?
I mean, on the one hand, it's very stressful. On the other hand, I have been overwhelmed by the support that I've received. It is not what I expected. I have received support from Switzerland, Australia, all over the world. I think people are scared to speak up. And so it's been gratifying in that regard. I mean, I've created a lot of enemies, but I've made many more friends. And so, I mean, I hope something good comes of it.
Are you a political doctor like the Methodist said?
Prior to COVID, I had absolutely no interest in politics. I have been sort of forced into an area of politics, but prior to COVID, I had zero interest in politics.
How would you like this whole thing to end?
Eliminate the mandates. Let people have a choice in how they deal with COVID. Recognize that early treatment is effective, but most importantly, I mean, we all want autonomy over our body. We don't want somebody telling us you have to have an injection. I think that there's got to be protection for doctors that have concerns, and I think that we need to get the politics out of healthcare.
Anything else, guys? Thanks, Al.
Thank you.
Steve, you want to say? The God's lawyers here, if y'all have any legally kind of questions.
Can you give us your first and last name for
Sure.
us?
Steve Mitby.
Okay, so will you tell us your name one more time?
Stephen Mitby. Stephen Mitby. My law firm is Seiler Mitby.
Please spell your last name, sir.
M-I-T-B-Y.
And can you tell us how you became involved with the situation?
Sure, I was hired by Dr. Bowden after Methodist announced on Twitter that they were suspending her privileges. We did a full investigation of this situation, and what we have found is Dr. Bowden is standing up for choice. She's standing up for choice by patients. She's standing up for the choice to receive early treatment for COVID. She's not forcing anybody to take monoclonal antibodies or ivermectin, but she believes that you should have a choice to do that because it's your health. And in this environment, there is no FDA-approved treatment for COVID. Every treatment that's being offered is being done off-label. And 2 years ago, nobody even knew what COVID was. So there hasn't been time to do the full kinds of studies that are needed to meet the FDA standards for approval of COVID treatment. But what we do know is that there is medical evidence and a lot of prominent doctors out there that believe that the treatments she's using, which don't just include ivermectin, they include other drugs as well, that they work. And her track record speaks for itself. She's treated about 2,000 patients, as she said, and she hasn't had to admit anybody to the hospital.
Sir, is your client suing Methodist Hospital?
We have no comment on that at this time. Prior to last Friday night, she had a great relationship with Methodist Hospital, and she's proud of the work that she's done with colleagues.
You said you did an investigation. What did that look like?
We looked at her track record and what she's done with these patients, and she's been a pioneer in the Houston community in early treatment and keeping people out of the hospital by using drugs. And unfortunately, some in the media have tried to portray her as a quack, as somebody who's offering quack medicine. And that's just not the case. She's using protocols that are being used by physicians all over the country with great success.
Do you have any proof of what she's been done, like any data on the patients that she's treating?
Her data, the fact that she's treated about 2,000 people and kept them out of the hospital. That's strong proof. There are other studies that support what she's done, and I'd encourage you to look at the work. Well, there have been academic studies. I mean, you look at the work being done by Harvey Risch at Yale University, look at the work being done by a lot of other academic physicians. There's plenty of literature about this, but I can speak to what she's done, and she's treated 2,000 patients successfully.
So can you talk about where you go from here, just what are your next steps?
Well, first of all, we want to correct the record and show the public what a great physician Dr. Bowden is. And we want to talk about her success and refute the negative and false message that Methodist put out on Twitter. It's very unprofessional for a hospital to be attacking a solo practitioner on Twitter instead of having a conversation with her. And so that's why we're here today. After that, I don't know what we're going to do. She has a number of options that she's considering, but the most important thing for Dr. Bowden is to keep treating patients, and that's what she's doing.
So one of the options is a lawsuit for defamation?
I have no comment on that at this time. She's considering a lot of different options, but the most important option is to keep treating her patients.
Because I think that, let's have any questions. I think the doc does want you to go to Methodist today and ask them to release their data, right? I think it's very important to see Stephen talk more about it, and maybe he's the one that should do it. But if they're going to be like the COVID experts, then tell people everything, right? Who's had infections? How many percent of people who were vaccinated and have COVID? It's not to say it's bad, good, but if they really want to treat everybody the same, and tell Houstonians the truth.
Right, it's time to have a scientific debate about this and not just attack people on Twitter. Unfortunately, this issue's become politicized. It shouldn't be. It's about science. Let's see the data.
Thank you.
Thank you.
Is that with a V or PH?
With a V.
Thank you.